kind of short term, but it's not going to fix anything. It just kind of prevents the problem from getting worse for a moment. Then you have something called the clotting cascade. Well, we're going to start with the platelet plug. So you have your vessel right here, okay? On the inside of your vessel, you have something called endothelial cells, okay? Which I'm drawing right now. And then on the outside of your vessel, you have something called the basement membrane. Now the basement membrane is actually collagen. So normally, you have your blood in here, you have your platelets, which are inactivated at this point in time. They're just floating through like normal. Now let's say you get a cut or something happens. And let's say you break through the membrane, kind of like that. So you damage your endothelial cells, and now the basement membrane is exposed to the blood. What's gonna happen is you have in the blood a bunch of things called von Willebrand's factor, or VWF. Von Willebrand's factor is attracted to collagen. It's gonna come, it's gonna bind to it. And on all of your platelets, you actually have von Willebrand factor receptors. Just kind of chilling for now. What's gonna happen is you're gonna have a platelet go, and it's gonna actually attach to the von Willebrand up there at the site of injury, thanks to the von Willebrand factor receptor. However, it's not activated yet. It's not going to activate because the von Willebrand factor receptor is a mechanically gated receptor that's activated by stretch. So it's when blood flow goes and kind of pushes it, it's going to cause it to stretch, and then you're going to have something that looks kind of like this. Platelet's going to activate, which means it's going to really swell up. Now it's going to express a few different things on its little arms out there, okay? The ones we're going to talk about are called your alpha granules. Okay, alpha granules are going to secrete something called PDGF, which helps with long-term healing. They're also going to secrete more von Willebrand factor, and they're going to secrete fibrinogen. Fibrinogen will later get activated. It'll turn into fibrin, and it'll help the clot dissolve when it needs to. Okay, you also have what's called your dense granules. Those are going to secrete ADP, calcium, and serotonin. All of which can go and activate more platelets. So they're going to just continue this. Another thing about fibrinogen, let me just is on your platelets, you actually have little fibrinogen receptors. We could draw them like this, kind of like bridges. So what's going to happen is you're going to have a bridge like that, and it's going to go and it's going to meet up with another platelet like that. It's going to hook it together. And that's how you get a plug, because you have lots of platelets coming, activating, and kind of all clumping together. The other things we have on our activated platelets is something called thromboxane, or as it's abbreviated, TXA2. This is also going to activate your platelets. Okay? So this is the clotting cascade. All of those, remember, so basically run through it one more time really fast. Damage the endothelial tissue. Collagen's exposed, von Willebrand factor binds to your collagen. Platelets bind to the von Willebrand factor. They're activated by stretch. When they activate, your alpha granules are going to secrete PDGF, then von Willebrand factor and fibrinogen. Your dense granules are going to secrete ADP, calcium, serotonin, and then thromboxane's also on there. Those four are all going to activate more platelets. When platelets are activated, they're going to bind together, clump together due to the fibrinogen, and then you're going to get a clot, also called a platelet plug. When it is attached to the wall, it's called a thrombus, and it's totally fine. If it somehow happens to break off, it's called an embolus, and it travels through the blood, can be very dangerous to you for pulmonary embolisms. That's what it is. Now if we do the clotting cascade, the clotting cascade is basically just what is happening to help your blood clot, if you couldn't tell by the name. So the clotting cascade begins with factor 12. Factor 12 is going to get activated like that, okay? Activated factor 12 is going to activate factor 11. Activated factor 11 will activate factor 9. Activated factor 9, with some help from factor 8, is going to activate factor 10. Factor 10 is a big one. Okay? This is called the intrinsic pathway. It's happening inside the vessel. Okay? Intrinsic. Now we're going to go over something called the extrinsic pathway. The extrinsic pathway begins when something called tissue factor, TF, otherwise known as factor 3. Tissue factor is something that's in the tissue, but it's not exposed to the blood. When it's exposed to the blood, it's going to bind to a clotting factor called factor 7. When it meets with factor 7, it's going to activate it. We're going to have activated factor 7. Factor 7 is going to activate factor 10. Okay? Once we get down here to factor 10, as you can see, these are different. So this is called extrinsic because your tissue factor is starting outside. Once we get to factor 10, it's the same pathway. So we refer to it as the common pathway. Okay, common pathway. Let me grab a chair. Factor 10, once it's activated, is going to activate factor 2. Factor 2 is then going to activate factor 1. Now these have different names. Factor 2 is also called prothrombin. When it's activated, it's just called thrombin. Thrombin, what it's going to do is it's going to activate something called fibrinogen. Remember, we already talked about that. It helps them clot together. It also is going to help dissolve them, which will turn into fibrin. What fibrin is going to do, when you have fibrin, fibrin's going to activate something called TPA. TPA is going to increase what's called plasminogen. It's going to go from plasminogen to plasmin. Plasmin causes your fibrin to dissolve. Now here's what's happening, okay? You have your clot. Let's draw a little clot right here. Okay? Here's your damaged tissue. What fibrin is doing is fibrin forms kind of a mesh, helping hold the blood clot really firm together. Now, you have actin and you have myosin here. They're going to be pulling everything together, and that's actually what's going to cause the wound to close. When you get a cut, you know how it closes? You do the actin. What's going to happen is your plasmin is going to come as this is starting to heal, and your plasmin, remember, activated by TPA, is actually going to start to dissolve the fibrin. As that does, this clot is slowly going to break apart, and then eventually you're just going to have your regular tissue, your skin. So it's kind of wonky, but fibrin actually kills itself through a pathway. This is the clotting cascade. Hopefully you guys learned a lot. Thanks for watching.